All right, things that we add into fluids. Usually, these are some of the fluid additives that you may see. 50% dextrose. They use dextrose to help correct hypoglycemia, or for patients that might possibly go hypoglycemic. And basically what 50% dextrose does is it only gives energy to the brain. It is not a caloric source, so you aren't gaining any calories by adding dextrose to fluids. Usually it's added to make 2.5 or 5% dextrose solutions. Another common fluid additive is KCl, or potassium. They use this for muscle contraction. Potassium is what makes your heart function properly. It works in that sodium-potassium pump, so it works with muscle, skeletal contractions. They would use this in a patient that was possibly anorexic, as well as a patient who's losing a lot of fluid from diuresis. They may be hypokalemic, so they have a low potassium. This can happen from vomiting. You want to make sure that you're giving it slowly. So you certainly usually do not just give potassium chloride. You administer it into a bag of fluid, and then that's calculated out to how much you want to give. Potassium chloride is distributed in MEQ, which is milliequivalents, and basically this expresses the ionic charges of the potassium. It's available in concentrations of 2 milliequivalents per ml. So 2 other additives to fluid that you might see: sodium bicarbonate. This is used to correct metabolic acidosis, especially if they have something like diabetic ketoacidosis. That's from having chronic diabetes that hasn't been treated. They could have renal disease that can cause some metabolic acidosis, shock, cardiac arrest. Usually cardiac arrest comes from some sort of metabolic acidosis going on. The final one is calcium. This is really used for animals that have eclampsia, so they're having problems after pregnancy. They use it for milk fever in cows. So not a real common use in medicine unless you're working with large animal, or you're working in a clinic that does a lot of breeding work. So have a good weekend, guys.